Patient preparation. Please take a moment to review the learning objectives prior to completing this presentation. The first step in drawing blood is to obtain a doctor's order. Blood may not be drawn without a physician's specific order. This may be written on a prescription pad, it may be faxed in, it may be written in the patient's chart, or it may be part of a doctor's standing orders in regards to hospitalized patients. At minimum, the order needs to contain the patient's full name, what tests the doctor wishes to have performed. The date of request needs to be included on here, and it should include the year. A diagnosis will be needed for billing purposes eventually. If a patient brings an order without a diagnosis, you may go ahead and collect the specimen and run the test, but follow-up will be needed in order to make sure that billing can be provided properly. The order must be signed by the physician. In some cases, doctors will call in a verbal order. These should be carefully documented with all the proper information and should be followed up by a faxed copy from the doctor's office as soon as possible. A requisition is then generated from the doctor's order. This may be a manual piece of paper, but more often it is entered into a computer system. It should contain the patient's name, a patient identifying number, generally a medical record number. Social Security numbers are being used less and less as identity theft is becoming a problem. Many requisitions will give the patient's location. It must include the tests ordered so we know what to draw. It will often give us the doctor's name, and it should indicate at what date and what time this specimen should be collected. When identifying a patient, you must remember this is your most important job. Anything else you mess up, if you draw the wrong tube, if the specimen's hemolyzed or clotted, we can fix this later. If you draw the wrong patient and label it with the wrong patient information, the techs won't always catch this. This is the thing you have to do 100% correctly 100% of the time. Incorrect patient identification has led to death of patients. A patient transfused with the wrong blood type because of an incorrect draw. Patients with results that are reported as normal don't get needed treatment, or abnormal results are reported, leading to unnecessary and even harmful treatment of the patient. For inpatients, generally you're just going to check the armband. Do not draw blood on a patient who does not have an identification band, and the identification band must be attached to the patient, not to the bed. For outpatients, you always want to ask the patient to give you a piece of information. Can you spell your last name? Not, are you Mrs. Jones? Often those who are hard of hearing are simply going to say yes, even if the lady in the chair is not Mrs. Jones. You should always verify using two pieces of information, most commonly the name and birth date. It used to be common to use the Social Security number, but again, this is something that is going out of practice quickly. Some patients require extra consideration when handling them. Unconscious patients should be checked very carefully to make sure that their ID is correct. You should continue to explain what you are doing. Some unconscious patients are aware of their surroundings and are simply unable to respond. ER patients present many problems. You should know your institution's policies before you need them, especially those dealing with unbanded patients or unidentified patients, often identified simply as John Doe. Never draw a sleeping patient. Try to wake them up. Some patients will sleep very, very deeply, and you may not be able to wake them, but always give it a try. How would you like to wake up when somebody had a needle in your arm? If the patient is not in the room, if the specimen is timed or stat, you should find out where they are and go get them, if at all possible. If it is a routine test, ask when they will return and document that the patient was out of the room, and make sure you follow up to be sure that the test is eventually drawn. If there is a visitor with the patient, you should explain why you were there and allow the visitor the opportunity to leave. I'm going to be drawing some blood. If you would like to step out for a moment, that would be fine. Allow the patient to decide whether the visitor should stay or leave. If a patient refuses, you cannot draw them. If you draw a patient who is refusing, it can be considered assault. This doesn't mean you can't try to talk them into it. Mr. Smith, these results are important to your care. I'll be as quick as I can. Can I please go ahead and give it a try? Mr. Taylor, if I cannot draw these now, when can I come back to get them? Would you prefer I wait until after breakfast? Obviously, if the tests are fasting, you cannot do this, so you might reword that to, Mr. Taylor, if I cannot draw these now, your breakfast will have to wait until it can be done. If the patient absolutely refuses to allow their blood to be drawn, you should inform the nurse or the physician, and you should document that the patient refused. You should follow up before the end of your shift to make sure that if the patient chose not to be drawn at that time, someone did go back and check. Before you draw a patient, you should always greet them and introduce yourself. You should explain your purpose for being there. You should verify that the patient has followed any pre-testing instructions, such as fasting or avoiding certain foods. You should always assemble the appropriate equipment before beginning the procedure.